Hi, this is Brian Kim. I'm going to share with you case number 103 in the best way to do cataract surgery series. This is a moderately dense lens and a medium pupil, and I'm going to show double chop, cross chop, mechanical fracturing techniques. I'm going to show you how I'm able to methodically and efficiently disassemble this moderately dense lens with a medium-sized pupil. So use the cotton tip to steady the eye, use a corneal marker which will help me to center and size my rhexis. I make a paracentesis incision first on the right side and then the left side. I make sure I'm flat to the iris plane to create a nice corneal shelf which will achieve a self-sealing incision. Inject some intracameral lidocaine and then some intracameral epinephrine and then some dispersive viscoelastic to coat the corneal endothelium and do some viscodilation. And this is a triplanar corneal incision. I make a vertical groove, place the blade into the deep part of the groove, tunnel, and then using the cannula turning the eye towards me, and then I enter. Push some more viscoelastic at the end there. Turning the teeth sideways, I go in with the rhexis forceps, puncture the center, pulling towards me, grabbing the right side of the tear to create a flap, going around circumferentially. In this case, the corneal marker and the pupil were of similar diameter, so this is going to be fairly easy to follow. Finish off the rhexis and burp some viscoelastic out. And this is the Capsulorhexis hydrodissection technique. I place a cannula under the rhexis edge contra-incisionally, pointing the tip down, get a nice wave, turn the tip back up, decompress on the left side, pointing the tip down on the right, and the lens begins to spin. Irrigate the surface of the cornea, lifting the incision with a chopper, going in with irrigation off to minimize Descemet's trauma, removing the surface epinuclear material, placing the chopper under the rhexis edge contra-incisionally, the phaco tip vertically sub-incisionally, bringing the instruments together, crushing and bisecting the lens in half, placing the chopper around the right heminucleus, bisecting the right heminucleus. Using some vacuum to lift that first quadrant up, crushing it and bisecting that piece, using mechanical forces to crush the lens pieces into smaller and smaller pieces, and then emulsifying the lens pieces. Use a little bit of vacuum to position the lens piece on the tip, and then I crush the lens piece between the instruments. I'm placing the chopper around the second quadrant, pulling it centrally toward the phaco tip and crushing it against the phaco tip, using some vacuum to pull the lens piece up and then crushing it into smaller pieces and then emulsifying the lens pieces. Using the chopper to lift that fragment up out of the bag, using crushing forces to make the pieces smaller and then emulsifying the lens piece. Turning the second heminucleus in front of me, placing the chopper around the lens, pulling it towards the phaco tip and crushing it against the phaco tip, doing the same maneuver against the third quadrant, bisecting that lens piece. It mobilizes that fragment. Use some vacuum to hold it and then crush it between the instruments into smaller pieces and then emulsifying the lens pieces. Placing the chopper around the last quadrant, pulling it centrally toward the phaco tip, crushing the lens pieces into smaller pieces, and then emulsifying the lens pieces. Grabbing the anterior part of the epinucleus, which comes out really nicely here, making sure the chopper is deep to protect the posterior capsule. Take the chopper out, push BSS in, take the phaco tip out, and I go in with the INA handpiece, Start sub-incisionally, removing the cortex from anterior to posterior so it peels more cleanly. Polishing under the rexus edge. Polishing sub-incisionally on the posterior capsule. Use a cannula to pulse the subincisional capsulorhexis. Filling the bag with cohesive viscoelastic, using the sweep to polish under the rexus edge. On the left side first. And then the right side. Widening the incision with the blade here. Again, I do this for denser lenses and lenses that have smaller pupils, because I do suspect there's some level of zonular weakness. Turn the bevel sideways, deliver the leading haptic into the bag, which is planar. As the optic comes out, rotate my hand 90 degrees counterclockwise, delivering the trailing haptic with the Maltzman. Go in with irrigation off, activate irrigation, go underneath the optic, removing the viscoelastic from within the bag. Polishing under the rexus edge, removing the viscoelastic from the anterior chamber, and then I'll hydrate my incision. So again, this is a moderately dense lens with a medium-sized pupil. I'm able to utilize mechanical fracturing techniques, crushing the lens pieces into smaller pieces, using ultrasonic energy more sparingly, able to leverage the concept of crushing forces to break the lens pieces down, and then utilizing ultrasonic energy to emulsify and remove the lens pieces. By doing it this way, again, I feel it's a very methodical, systematic, safe way to fracture the lens piece into smaller pieces without going after it with ultrasonic energy and high vacuum. Again, in those situations, when you're having to depend upon the machine to do the hard work, I feel like it's much more advantageous to be able to utilize your hands with your instruments, hooking lens pieces up out of the bag, crushing lens pieces with mechanical forces. And so this is the way I prefer to do cataract surgery. So I hope this was helpful to you, and I thank you for your attention.